Hello, this is the 8th in our series of short videos demonstrating the key components of the care protocol used in the gastroschisis interventional study in Ghana, Zambia, Malawi and Tanzania. This video is focused on establishing breastfeeding, changing the dressing, discharging the patient and following them up. This baby had their abdomen closed today. I'm sorry that the dressing doesn't stick so well in these silicone models. Now we're going to use a breastfeeding protocol to establish the breastfeeding for this baby. The quicker we can get the baby breastfeeding, the higher the chance of survival. So the first day of closure, you don't make any changes. The baby can still have 1 ml of express breast milk every 8 hours and can be soothed in between with breast milk on gauze or on a finger. The nasogastric tube is still on free drainage and should be aspirated every 4 hours, and the loss is replaced mil for mil intravenously. The next day, you're still leaving the nasogastric tube on free drainage, but the baby can start breastfeeding. That's 5 minutes of breastfeeding every 8 hours, and it can be timed by the nurses to help the mother and recorded in the notes. You no longer need to aspirate on the nasogastric tube. Then the following day you're going to clamp off the nasogastric tube and repeat with the same. 5 minutes of breastfeeding every 8 hours. And you'll gradually build up as the days go on following the protocol. So the next day will be 5 minutes 6 hours, and then the next day 10 minutes 6 hourly, and then 10 minutes 4 hourly, 15 minutes 4 hourly, and then 20 minutes every 2 to 3 hours, which is full breastfeeding. Now, how to monitor whether you can go up or not. It's okay for the baby to have small posits. That's a normal process. Even if they're slightly bile stained, that's quite common in babies with gastroschisis. You don't need to stop going up the protocol as planned. Obviously, if the baby vomits profusely, then you'll need to stop and go back to what the baby was tolerating on the day before and then start building up again. One thing we do that can help is to have the baby slightly inclined in their cot by placing something under their mattress. Once they're half breastfeeding, you can reduce the amount of parental nutrition support by half, and then obviously stop the parental nutrition when they're fully breastfeeding. And the baby should be gaining weight for at least 2 to 3 consecutive days before they can be discharged. Okay, so what about this dressing? Now, it's important to be vigilant to make sure that this dressing does not come off within the first 10 days. If you start to see it peeling off, you need to change it in the same manner that it was applied during the closure period, with the baby sucking on some milk to keep them settled. As you peel off the dressing, you should put your hands and hold the wound centrally to prevent bowel reherniation. Clean it, apply the strips and another tegaderm. If the bowel does reherniate, you can get this sort of appearance, and this herniated bowel can fistulate, which is associated with a high mortality. So you must try and prevent that at all costs. So once the dressing has been on for 10 days, however, you can then change it. Please don't change it routinely beforehand. It always starts to look discoloured underneath. You don't need to change it for that reason. So at 10 days you can remove the dressing. This is what you'll see. The granulation tissue over the bowel, and the cord will still be moist because it's been under the dressing. The wound is not secure and strong at this stage, so you can't, during the dressing change, you want to keep your fingers on to support it, and you can't leave it without a dressing or it could reherniate. So apply a square of gauze and another tegaderm. Then before the baby goes home, normally within the next few days, you want to change the dressing again. You can see that the defect has decreased in size, the granulation tissues become stronger, the cord is still moist. So apply another square of gauze and tegaderm, and at this stage the baby can go home, and then see them either in your clinic or in a district hospital under your surveillance in a week's time. And this is what the wound can look like then. It's got much stronger, the cord has dropped off. You can clean it up and apply honey, and after about 3 weeks following the closure, you no longer need to apply a dressing and it should heal up. This is just 3 days later. You want to, at that follow-up appointment, also make sure that the baby's opening their bowels regularly. If not, you can use the glycerine suppository as required, and make sure the baby continues to grow. And you'll want to see them weekly for the first few weeks to check the wound, check the baby's growing, and check their passing stool. And this is what the baby can look like at 3.5 months of age. You can hardly tell that they've had gastroschisis. Some may have umbilical hernias, but they can be managed at a later date.